Hello, my name is Cheryl Wagner, and I'll be sharing my implementation of bedside reporting to improve the quality of patient-centered care. There are many studies that have been conducted listing the benefits of bedside handoff reporting. Bedside reporting brings the plan of care to the patient, allowing them to be directly involved in what's currently taking place with their plan of care. It also improves the quality of nurse reporting, leaving little time for joking and irrelevant information, and bringing the focus back to the patient. In this presentation, I will share the improvement of quality and efficiency that took place during change of shift reporting at my institution, while increasing patient and family involvement and promoting safety. The quality standard being addressed is the decrease in the quality and efficiency of change of shift reporting on my unit. I have also noticed a lack of patient and family knowledge regarding the current plan of care. I believe the source of the quality variance comes from a lack of consistent bedside reporting during change of shift. One of Providence's core values is that of excellence, which is setting the highest standards for caregivers and transforming conditions for a better tomorrow while serving the needs of today. Their mission statement reads, "To reveal God's love for all, especially the poor and vulnerable, through our compassionate service." As a caregiver at Providence, I believe that striving for excellence includes incorporating evidence-based practice to help improve the quality and safety of the people we are caring for. One of the hospitals in our ministries recently made it a point to exemplify Providence's core values by calling for a change on their unit. They proposed a model of care to draw families and the care team together with patient-centered goals, transparent communication, and team collaboration to provide skilled, compassionate care. I saw a need for improving the quality of change of shift reporting taking place on my telemetry floor. A recent qualitative study focusing on handoff reporting observed 20 nursing handoff reports, which included the following challenges: great complexity in nurse shift-to-shift report, the struggle to balance competing demands for their time, the maintenance of confidentiality of patient information, and delivery of patient and family-centered care. Standardizing reporting methods among healthcare professionals has been a goal of the Joint Commission since 2006, and improving communication has been an initiative since 2000. Improved communication and reporting methods have been shown to improve patient care and satisfaction levels and decreasing the number of sentinel events reported by hospitals. The current method of handoff shift reporting on my unit consists of the offgoing RN reading to the oncoming RN a report from a hard copy of personal notes, which does not allow the oncoming nurse to verify information in the electronic health record. The report is conducted at the nursing station or outside of some of the patient's rooms, and the patient is only sometimes introduced to the oncoming nurse before shift handoff report is given. This means that the patient is usually left unattended for at least a half an hour while the RNs are exchanging information, and leaves no opportunity for the patient to ask questions or clarify information firsthand. Bedside reporting is a part of Providence Health and Services caregivers policies. Heaton, a Service Excellence Program coordinator, highlights the policy in the Providence Healthcare Nursing Annual Report, stating, "Bedside shift report is an evidence-based practice that includes the patient in the reporting process during change of shift. The benefits of bedside shift report include increasing patient involvement and understanding of their plan of care, decreased potential for errors, and increased accountability and a sense of teamwork between nurses." Patients and family members report a feeling of safety and being part of the team. Because the conversation occurs with the patient present, it builds trust by providing an opportunity for the patient and family to meet the oncoming nurse and to clarify questions from the offgoing nurse. So why are nurses continuing to give report at the nursing station despite all of this evidence that bedside reporting is more beneficial? It is my belief that the root cause analysis of this continued behavior is that there is currently no plan in place to implement this quality improvement. Other contributors to this quality variance is that our policy is not being enforced by management. There is no accountability for nurses to give bedside report, and nurses are accustomed to giving report at the nursing station. Also, the benefits of bedside reporting has not been identified by management or nursing staff. Supporting processes contributing to the root cause of this quality variance includes the lack of management present during change of shift handoff report. On occasion, our unit manager will be on the unit during change of shift, and I have noticed more of the nursing staff giving report inside of the patient rooms when this happens. Another process contributing to the lack of bedside reporting is the amount of experienced and BSN prepared nursing staff. Our unit is filled with new graduate nurses who are often more reliant on the more experienced staff to exemplify nursing standards. The few nurses that have experience on our unit have been working there for 10 to 20 years, many of which are not BSN prepared and do not have management experience. They are used to giving report how they've always done it, and the new graduate nurses go along with the experienced nurses, what the experienced nurses initiate. Management does not intervene and change is not initiated. Finally, there has been a recent high turnover with our regular floor staff. This causes the unit to rely on registry, travel nurses, and staff floated from other units to help care for the patients on our floor. All of these factors lead to the lack of consistency in implementing a high-quality reporting practices on our unit. So the issue at stake here is the lack of quality handoff reporting. The stakeholders include patients, nurses, the nurse leaders, and management. Additional stakeholders include families, doctors, the institution or the hospital, and the community at large. Poor handoff reporting leads to missed information, decrease in the quality of care given to patients, and ultimately the loss of productivity. When patients are not involved in the plan of care, they exhibit confusion, dissatisfaction, and a lack of compliance in their care, which can lead to poor patient outcomes. Conversely, quality handoff reporting leads to receiving accurate information regarding the patient's condition, improved quality of care, and an overall increase in productivity on the unit. Patient involvement in their plan of care leads to satisfaction and compliance with the plan of care and improved patient outcomes. The solution is to develop a plan to improve the quality of shift handoff reporting. The goal is that at the end of 8 weeks, all nurses on my unit will be participating in bedside handoff reporting during every shift exchange. According to a recent study, nurses found that bedside reporting gave patients an opportunity to actively take part in their care. Over half of the patients involved viewed this information as being given during bedside report as information meant for them as well as the oncoming nurse. This study also pointed out that nurses are in a unique position to promote patient participation by encouraging questions and clarifying information. It was largely found that bedside reporting is worth developing, and most patients and nurses desired it to continue in the future. Another study showed that there was a decrease in incidental overtime and increases in both direct care and value-added care. This was attributed to hourly rounding at bedside reporting. There was also found to be a decrease in events such as falls and codes from cardiac arrest. During the time of the study, the percentage of time nurses spent in direct care activities increased above the national median. A recent study conducted by the Joint Commission points out the benefits of bedside handoff reporting, stating that shift handoff between the offgoing and oncoming nurses must include all critical information about a patient's plan of care for the next few hours. The best way to communicate that information is bedside reporting. Bedside reporting has been shown to increase patient involvement and satisfaction, boost teamwork and accountability, and improve effectiveness of communication among caregivers. As with any transition, there will always be resistance to change. This transition can be made smoother by extensive planning, training, and gradual implementation. The first step is to present the plan to my nurse manager for my solution implementation, and then to design a timeline in which the goals will be met. I proposed June 27th through August 14th, which is the duration of this course. The goal is that by August 14th, 100% of nurses will be giving report at the bedside each shift. I then participated in the unit huddle and with my manager's help, proposed the plan to the floor staff. They were largely agreeable to the plan. The unit managers agreed that they would be present as much as possible during change of shift report. I also asked if there would be volunteers to support and encourage nurses to give report at the bedside. Daily rounding sheets would be signed when the nurses gave report at the bedside, and the results would be tallied by the unit secretary. The charge nurse would gather information regarding patient satisfaction each shift by asking the patients if they were satisfied with how the nurses included them in bedside reporting. All of these measures were designed to implement a team approach, assuring success of this quality improvement measure. The goals included that by July 3rd, at least 80% of all nurses on the floor would be aware of the quality improvement plan. By the end of July, I would participate in a meeting checking in on the success and participation of key players. The goal at that time would be that 50% of the nurses on the unit would be giving handoff report at the bedside. And by August 14th, the goal was that 100% of the nurses would be practicing bedside reporting. Anticipated benefits to this quality improvement measure would have on the workplace included an increase in patient satisfaction, increased patient safety, a sense of accountability of nurses to improve the quality in the workplace, pride in our work, and a sense of cohesiveness among coworkers with the implementation of a standardized reporting system. To collect pertinent data, the unit managers would keep track of how many times they are present on the floor during shift changes. The unit schedule would be reviewed to determine that there is at least one bedside reporting champion present during each shift change. Daily rounding sheets would be collected by the unit secretary and signatures tallied to determine the percentage of nurses present at the bedside during shift change. And a running log would be kept for each charge nurse to reflect on patient satisfaction information collected from patients during each shift. Finally, general feedback would be obtained from the nursing staff. Between the two unit managers, there was a management to be available 6 out of the 7 days for one shift change day, a day only. This led to a maximum possibility of management present during change of shift 47% of the time, although there were 1 to 2 days a week per week where management would have to attend meetings during this time so that they were not able to be on the floor. They also planned, there was also planned vacations for management during the time of the project. The time management spent on the floor during shift change between July 31st and August 14th was about 28% of the time. 5 people, in addition to myself, volunteered to be bedside reporting champions. On review of the schedule, reporting champions were present about 71% of the time during the shifts. They reported giving bedside report approximately 50% of the time. Obstacles to this quality measure included time restraints, concern for patient confidentiality, and inconsistencies enforcing the policy. The handoff reporting sheets were signed about 20 to 30% of the time. This may not reflect the actual percentage of bedside reporting being conducted because it does not account for nurses giving bedside report and forgetting to sign the sheet or lost sheets. It still served as a tool to hold nurses accountable for bedside reporting, so it was still a valuable tool. At the start of this project, it was proposed that the charge nurse for each shift would keep a running log of patient satisfaction feedback regarding their perception of bedside reporting. Only a few entries were noted at first, and then the log was eventually not used. This was due to, believe inconsistencies in charge nurses on our unit. There were multiple absences for regular charge nurses, so new charge nurses had to be appointed and fill in. So this log was sort of lost in the process. So the general feedback from our floor nurses was that they were in favor of bedside reporting and found it very helpful during the change of shift. They reported it was not always realistic because of time restraints, and the patients sometimes needed to rest or were sleeping, and too many interruptions from family members at the bedside was also a little bit of a deterrent to the bedside reporting. Some details of the report were confidentiality issues as well that needed to be discussed privately between nurses, such as psychiatric conditions of patients. But overall, nurses reported that they wish to continue to integrate bedside reporting into their practice. I personally observed nurses giving report at the bedside more frequently when management was on the floor, so that's something that definitely needs to be followed up with. The presence of management alone increased compliance. Since bedside reporting champions were only present for 71% of the shifts, I believe there needs to be more volunteers and people be holding themselves and their coworkers accountable for bedside reporting. This will encourage more nurses this will encourage nurses to encourage one another. Additionally, nurses need to be encouraged to sign the bedside reporting sheets and be reminded, to get into a habit of doing that, because it's an important way to measure the success of, how many people are actually giving bedside report. And bedside reporting sheets should be discussed, bedside reporting, the sheets and the practice should be discussed at bi-monthly meetings at least, just to reiterate this new practice. Since patient satisfaction data collection by charge nurse was widely unsuccessful, I have decided that that wouldn't be a good way to continue. So a new way to collect information needs to be implemented, a new way to collect information from the patients. This could be in the form of a questionnaire for the patient to fill out before discharge, like a piece of paper, so that they can give feedback. And this will allow for immediate feedback from the patient regarding the effectiveness of bedside reporting and what their perception is on it. Overall, I was very satisfied with the outcome of this quality improvement project. The data collected shows that nurses on my unit were now reporting handoff up to 50% of the time, sometimes more, sometimes less. And although there's still room for improvement, this is a great start. Thank you very much, and here are my references.